Welcome. Today we're going to talk a little bit about pandemics and the current COVID-19 crisis. First of all, pandemics are not unusual in American history. In fact, just in the last 100 years, we've gone through several different pandemics. We had the 1918-1919 pandemic, which killed 675,000 Americans and potentially 25 to 50 million people globally. It was a terrible outbreak and one that the world had a great deal of trouble dealing with. But in the United States, we also experienced the 1957 so-called Asian flu, which was an N2 illness. It killed 116,000 people in the United States and also killed up to 2 million people globally. In 1968, we had the so-called Hong Kong flu, which killed 100,000 people in the United States and globally killed 1 million or more people. We had a swine flu epidemic in 1976. It was not a pandemic, it did not spread globally. But in 2009, we actually had a pandemic, the swine flu pandemic, which killed 12,500 people in the United States. And of course, here we now have COVID-19, which is the coronavirus or novel coronavirus, or sometimes called the SARS coronavirus too. There's been hundreds of deaths in the United States. And so what is it about this particular crisis that we can use history to teach us about? Well, certainly, let's talk about the 1918 experience. The great influenza of 1918 through 1919 was a global pandemic, the origins of which we're not sure. It may have begun in the United States, although that's unlikely based upon what we know historically about where viruses begin. They generally begin in Asia and spread out to the rest of the globe. So there is actually some evidence to say that that's what happened there, but historians just don't know. In 1918, there was no science of virology, really. It was somewhat speculative. Viruses are submicroscopic, and so difficult to see in 1918 with the equipment they had. Once we got the scanning electron microscope, we were much better able to identify the structure of these viruses. So initially in 1918, the response was to see this as another kind of bacteria and to treat it as such. They even had a vaccine they tried. Of course, it was very ineffective. We didn't have antivirology drugs. We certainly didn't have antibiotics. We didn't have penicillin, for example. And the other thing that happened in 1918 is the world was very different. You have to understand that in 1918, there was no real federal presence in natural disasters, except in a sort of ad hoc way. It's not until 1950 that the first legislation that gives the federal government an actual status in disasters and pandemics is passed. So in 1918, virtually local and state governments were left on their own. Not only was the federal government not necessarily involved, but Woodrow Wilson seemingly intentionally ignored this to focus all of his efforts on the First World War. 1918 was a big year. It was, of course, the year that the war would end. But that's when U.S. troops really were making a difference in Europe and in pushing back against the Central Powers. So what did we learn from that? You know, the only way they could really treat this illness in 1918 was through social distancing, through surveilling and then individuals to isolate those who had the symptoms, to trace where they had been, and then to isolate those or quarantine those individuals, and in some cases to take extreme measures of locking down cities for a time to keep people from spreading the illness. Now, that was very effective in 1918, and in some ways, the illness that was going around in 1918 was more virulent, was deadlier, but also the onset of symptoms happened in a matter of hours. So this made finding the people who had it and isolating them much more effective, so that you didn't have, the massive statewide lockdowns. You had cities locking down, but not necessarily entire states. The reason we have to do that now is it turns out that COVID-19 has a stage of incubation before symptoms begin. it could be anywhere from 5.5 days to 14 days. And this virus seems to more effectively live on certain surfaces than the 1918 virus. And it's more difficult for authorities to figure out who specifically to isolate. So I think that's part of the problem and why you're seeing some of the measures we're taking. In 1918, you'll see pictures of people wearing face masks as an attempt to stop it. Sadly, the face masks that they wore then were less effective than some of PPE equipment that is in high demand now for our healthcare workers and others. Again, if we think about the various viruses and pandemics that we've had in the 20th century, they certainly have affected populations. The 57 and 68 pandemics were, as I mentioned, fairly deadly. They tended to attack the very young and the very old, and so therefore their effect on society was significant for those populations. And if you look back in the past, you'll find that, yeah, schools were closed, or they had extended vacations during those time periods in an attempt to protect those populations. COVID-19 is a little different. It doesn't seem to be as challenging to the very young. And some of that might be because of our social isolation, but it seems to attack the vulnerable populations, the elderly, but also there are some 20-somethings, very healthy 20-somethings that are getting this illness and being hospitalized and being on respirators. So this is nothing to take lightly, but it is showing some really key differences that we want to keep in mind, right? So this virus began in Asia, we know. It began probably in late November of last year, 2019, which is COVID-19. And was probably not really noticed as much until December of 2019. And the Chinese government did not take as effective action against it as we would have hoped they had. They might have been able to isolate it even better to keep it from becoming a global pandemic. Certainly people were coming in and out of Wuhan who had it and passing it on. And very quickly it spread to the rest of Asia by January. By January, the World Health Organization was involved and was investigating this. And I have to say they did some really interesting things in sequencing this, taking DNA and figuring out the genomic sequencing of this virus and understanding what it's made up of. But again, knowing that is not enough to fight it. Right now, certainly people are working on a vaccination, and we're certainly working on treatments, again, because this is a little different. This is definitely a little more deadly than your typical seasonal flu. It's certainly deadlier than the swine flu of 2009. It's not quite up with where the severe acute respiratory syndrome, or SARS, was, a pandemic that began in the 21st century. But it's definitely more contagious, right? It's not maybe as contagious as smallpox or measles, but it's definitely more contagious than the common cold or the seasonal flu, which is, again, making it difficult for authorities to fight this and healthcare workers. So we need to keep this in mind. And again, we talked a little bit about the incubation stage and the fatality rate being higher. So how did this become a pandemic? How did it go from being an epidemic? It's interesting. It may have begun as a typical virus in bats that was spread to pangolins, which are these armored creatures that live in China, who are often consumed by the Chinese and sold in the wet markets. And we know that that's where it began. It began in this particular market in the city of Wuhan. And so it spread from there. So it's an animal, a virus that is now mixed with human viruses to create a very deadly and difficult to fight. So by February of 2020, the Center for Disease Control in the United States was warning that this was going to be quite bad for Americans. Even as they were testifying before Congress and issuing warnings in February, I have to say federal officials were slow to act. President Trump, who was in India for a trip at the end of February, said that we had it under control, which turned out to be erroneous. And so federal officials were slow to respond, to clamp down on international travel. And again, if you will, the response was much more effective at the local and state level, which is not uncommon because, again, the Constitution says that health concerns, natural disasters even, really do belong in the domain of state and local governments. I have to say their dire warnings, public health commissioners in counties began to shut down schools and to call for social distancing long before the states did. The states then involved. As you know, many states have taken a pause, like New York, California, Ohio, but others as well. Some states have resisted that, and certainly they are testing how this will affect their populations. But by February, then it was of grave concern. You also know that the cases are rising. What we're trying to do is, because we don't have a vaccine and we don't have good treatments, and we have a limited number of healthcare personnel and beds for people, we're trying to take what would be a spike, a giant curve, and to flatten it so that we spread over time, right, this illness. Time is what we need for a variety of reasons. Most viruses are a dramatic increase in the spring and the fall. For a variety of reasons, they still linger in the summer and you'll still get sick. But it doesn't seem to be as easy to spread. That might give us time to come up with treatments, if nothing else. Certainly build out capacity for hospitals and to increase some of the protective equipment for our healthcare workers. At the same time, it would also be a wise way for us to come up with a vaccine. We have to be careful not to rush that in. In 1976, Gerald Ford rushed a swine flu vaccine in for what turned out to be an epidemic rather than a pandemic. And there was some bad results. Some people had Guillain-Barré syndrome because of that. So we have to be careful with how quickly we respond to this. But this is certainly something that we understand and can deal with effectively. As a historian, what we like to do is we study the past, not just because it's something that's interesting to us, but also because we're hoping that lessons from the past can be applied. I wish that were the case here. John Barry's book on the Great Influenza, which came out at the turn of the 21st century, had an afterword which warned us that we didn't have enough equipment. And certainly our response to this has shown the lack of preparation and mitigation. So hopefully in the future we can take this and add this to our policy. Well, thanks a lot for listening, and I hope that this has been informative.